it's not going to be in the near future before we'll be able to meet in person again. So let's see if we can at least have a Zoom award ceremony. So fortunately, both John and Fred were available for today, and so that's what we're doing. So I'd like to introduce John Broderick, who is the Senior Director of External Affairs for Dartmouth Hitchcock Health, and has a distinguished legal background that includes serving as the Chief Justice of the New Hampshire Supreme Court. But over the past 2.5 years, he has stood before more than 70,000 students in more than 80 New Hampshire and Vermont high schools, where he is simply John Broderick, father and husband, who has a story to share and a challenge to issue. And the challenge is change the conversation on mental health. Back in 2002, he was assaulted by his eldest son that nearly cost John his life and sent his son to prison. The family saw their son's alcohol abuse, but it was really the depression, anxiety, and sheer panic that afflicted him. In prison, he received treatment and medication, and the family began to mend. In early 2016, John decided to bring his family story into the light as the chairman of Change Direction New Hampshire. From there, he created his own initiative, now sponsored by Dartmouth Hitchcock, called REACT, a campaign to educate people on the signs of mental illness and how to help themselves or someone else in an effort to end the social stigma. John has said that what he's doing now is the most important work he has ever done. And as I said, he's visited, told his story to 70,000 students and driven his car 25,000 miles over Vermont, New Hampshire roads, making more than 175 presentations. John, it is an honor and a pleasure to have you as our 2020 Lilla McLane Bradley Award. Would you like to say a few words, please?
Sure. First of all, I'm really honored by this because it reaffirms the work I'm trying to do, and it puts a spotlight on mental health. Just to update your comments, before COVID struck, I had traveled 80,000 miles by car, spoken to 110,000 people, and been to 230 or 250 middle schools and high schools. I have hugged thousands of kids who approach me after I speak, and it's been very eye-opening and humbling for me. I'm like a lot of baby boomers who didn't talk about it, didn't learn about it, didn't know much about it. And I realized how wrong that was. And if I could speak every day in front of a different audience, I would do it. It's a discussion we need to have in our state, in our country. We've been too late in having that discussion. All of the people on this board, by the way, you have my highest respect for what you're doing. I'm pretty late to the dance, but I see the urgency now. And I'm trying to get people to start a different conversation around mental health so we can normalize it, demythologize it, destigmatize it. The story that I tell, by the way, around New England does not have me as the hero, by the way. I failed miserably and I harmed my own son because of my lack of knowledge. And he's been very proud of what I've been doing, which makes me very proud of it too. And my wife really is the one that kept the wagons heading west as we went through a very public tragedy, which I would not wish on any living soul. But we came through it. And I'm proud of the effort. I'm saddened that COVID has intervened because I would have been putting on more miles and hugged more kids. But it won't really matter. It won't really matter until we start to have a very public discussion about this issue, which affects countless families and individuals. It always has. Maybe it's worse than COVID, but it wasn't like it started with COVID. The number 2 fellow in psychiatry at Dartmouth Hitchcock, Will Torrey, who I have great regard for, was asked last November at a public forum how he would rate the mental health system in this country. It's a pretty timely question. And he said that night, he said, that's a very interesting question. Let me answer it this way. The way we treat breast cancer today, not 30 years ago, today, I would rate that as pretty close to a 10 on a 10-point scale. We get people in quickly, we have very good protocols, and we're seeing very high success. But on that same 10-point scale, this was November 2019, I would rate the mental health system in the United States as a 1 or a 2 on a 10-point scale. That is immoral in my mind. It's medically contraindicated. There's so much that we can do and that can be done for people who are suffering. And unless and until people are willing to say publicly, my mother, my father, my cousin, my best friend, myself, when it comes to mental illness, we'll never change it. As long as it's kind of in hushed tones, behind closed doors, nothing will change, nothing has changed. We're a little better than we used to be, I know that, but we're a long way from where we need to be. And the community mental health centers, of which you are obviously a key part, are what makes the delivery of mental health services possible in our state and across the country. But we're not meeting our obligations to you either, and you all know that. Well, we need to be doing more and talking more and changing. In any event, I'm grateful for the award tonight, not only for whom it's named and her remarkable history, but for what all of you do and what all of you have devoted a lot of years to doing. And I'm doing what I can, but we need to change it. That much I'm sure of. And if you look at the youth risk behavioral surveys, which I didn't know about 4 years ago, and now I can't get them out of my head. The youth in our country, in our schools, in our towns, are suffering anxiety and depression at epidemic levels. The rate of suicide for people 10 to 24 has increased 56% from 2007 to 2017. I know that now, but I wouldn't have. And it wouldn't have been on my radar. It's on my radar every day now. That's the kind of information people need to learn and accept and hopefully act upon. There's so much work to be done. But anyway, thank you so much for inviting me. Wish it were in person. I'd like to meet all of you personally. But with the virtual world, this is as good as we're going to be. But please know how much I appreciate what you're honoring me with tonight. Because it makes me feel like what I'm doing is of some value. So thank you all for that.
Thank you.